So let's address the respiratory system.
Well, I'll start with massage. You can do a lot with the respiratory system. Let me first say that massage is not going to get rid of your allergy, or it's not going to get rid of your asthma, or whatever the cause is. For that, you would obviously see a doctor, or perhaps an acupuncturist, or another holistic modality that can address that specifically. But what massage does for people with respiratory problems, it relaxes all the muscles associated with the respiratory system, so your body works easier in doing its job and doing its breathing, which is really the point of massage. Is not for us as practitioners to fix you. It is to manipulate the muscles and soft tissues so your body can get back into what's known as homeostasis, the state in which the body functions the best and the easiest. So specifically for asthma or respiratory issues, there's a protocol where I work on all the chest muscles, the diaphragm, abdominal muscles, scalene muscles in your neck, and it's in most cases pretty successful in allowing you to start to breathe, and I've had some cases where a client who had asthma, who had some kind of reaction to something, called me and needed me to come right away, and in most cases I can do that. And
So relaxation.
it's to do that, but the relaxation of massage also is a big benefit in helping the respiratory system calm down.
Okay.
I guess there's various ways to approach the condition, partly whether it's acute or chronic, but if people are getting exposed to instigators or getting a certain load, and you try to evaluate what's their total load, like so say they're being more sensitized to allergies, maybe they have food allergies as well that make them more susceptible, they develop a weakness, and then they get another load onto the threshold, and they kind of get above the threshold where they start having symptoms. So sometimes I think about, if you analyze the total load, where are the places where we can have a choice and effect on decreasing the load that we're taking. So say you do have like a gluten allergy or something that you want to address that might actually like strengthen the person by sort of decreasing that load that's creating a constant inflammation and strain on the adrenal system and in the gut. And most things come in, the gastrointestinal tract sort of through the mouth all the way down through is where you get exposed to a lot of things that can create a reaction in your body. So I try to work a lot on strengthening up their energy resources through the adrenal glands, decreasing the loads they're getting in. So you also don't necessarily go run around in the area that you're most sensitive to if you have allergies. So you have to sort of on all aspects look at the lifestyle and see where you can decrease and then shore up their systems. And there's ways to kind of heal up the gut lining and decrease the load. Sometimes I do food allergy testing, or I do testing on the allergens in the environment if that's something that we want to look at. Other times it's strengthening the organs that actually go the lungs itself, but even in sort of in acupuncture land, we talk about strengthening the kidneys to help the lungs. And so there's different pictures you can think of about how you want to strengthen someone. And sometimes it depends on what modality I'm thinking about or that we want to work on. And I think in these different pictures, and sometimes I use several of them together. Homeopathic remedies can be good acutely, and if you know someone's constitutional remedy, you always support them with the constitutional remedy, sort of no matter what's going on. So there's a lot of choices and ways, and usually by doing those combination of things, you're going to be guaranteed some results if people are actually doing the homework, so to speak. So sometimes it's a combination of using the testing if it's necessary, but sometimes you get a lot in the story that gives you a place to start that's very obvious, and then you take it.